Okay. Hi, everyone. This week, I wanted to take a minute to talk about what everyone else is talking about. That's the coronavirus, COVID-19. I was going to title this something a little bit different than what I ended up with. It was going to be something along the lines of what Tracy and I are doing to deal with this on a personal level. And we'll talk a little bit about that later. But as I was preparing this, it really turned into something very different. So let me just walk through this with you. Won't take that long, frankly. Here's what I'm not going to do. I'm not going to pretend that I'm a medical professional. I'm not going to pretend that I'm a scientist or that I've got this all figured out. I'm not going to discuss all the theories of how this started, whether that be official claims that this all started in an open market that included a lot of wild game, or that it started in a level 4 biolab, or that it was started either by the Chinese or by the Americans or anyone else for that matter. As far as I'm concerned, all I can say is I don't know right now. In terms of its origin, for me, everything is possible and everything is suspect. And I certainly won't be affected by those mainstream media soldiers who keep trying to smack down so-called conspiracy theorists, who support even the possibility that this pandemic could have been created by humans. But I'm equally distant from those people who are convinced it's a false flag of some sort, intentionally designed to create the next big panic. Again, I don't know. And the fact is, neither do you. So maybe in time, we'll get this all figured out, and we'll get to a conclusion with some confidence. But right now, I'm just keeping it up in the air. I'd rather talk about what we're facing right now. I mean, just a week ago, it looked like we were facing a virus with a mortality rate more than 30 times out of an ordinary flu. That was pretty scary. Now, realistically, that number seems to be quite a bit lower than that. It's still high, but it's almost certainly much lower than the earlier estimate by the World Health Organization that the mortality rate of coronavirus, COVID-19, was. They had it at one point at 3.4%. That's really high. It's now quite clear that the virus is much more widely spread than people previously realized, and that's going to lower the mortality rate. This is entirely due to the lack of testing capability in most nations. So that being so, we might be looking at a virus with a mortality rate of 1%, maybe a little higher, but maybe a little less. Now, that's still 10 times more deadly than a flu, but it's a lot better than what many of us thought even a short time ago. But this also means that this new coronavirus spreads extremely easily and is certainly deadly enough to be a real threat to the world, particularly the older you are and the more medically at risk that you are. Some people think the world's gone into a ridiculous panic mode over this, blowing things out of proportion. And just from observation, this isn't a scientific research that I've done here, but I definitely think that there's some generational divide on this matter. I mean, as you might expect, older people in general are going to take these warnings more seriously than younger people. Nothing to be surprised about. For me and my wife, Tracy, we are taking it seriously. Over the past several weeks, we've gathered information about this virus as it's spread around the globe. It was pretty evident several weeks ago. Honestly, I think it was even pretty evident by late January that this was very likely going to cause global mayhem and havoc. And, we weren't the only ones to think this, obviously, but I do think many people have been caught off guard. Even a week ago, lots of folks were not taking this thing seriously, in my opinion. Things around the world are bad, and they are very likely to get worse before they get better. Right now, Europe is in the midst of it. Italy is being ravaged by the coronavirus. Germany, France, Spain are primed to go through the same level of tragedy if nothing changes. Iran is still being hit very hard by this. And here in the United States, we are only just now starting directly to confront this situation. I should have mentioned UK, which is now just starting to look at some serious problems as well over there. But I really believe that there is cause for optimism. I'm not just saying that. We see what's happening in China and South Korea and other East Asian nations. They at least appear to be starting to get this epidemic under control. China did the extreme lockdown and quarantining of its population. Hundreds of millions of people. That seems to have worked. It's interesting because it seemed though the problem there was very close to getting totally out of their control. But it does look, as far as we can tell with the numbers, that they have blunted the epidemic enough that it looks like maybe they've turned the corner. But here's the thing, all right? We are not China. Not here in the United States and not in Europe. The Chinese government had no problem implementing measures of population control. They did it immediately, and they did it on a wide scale. Measures that would stagger most of us in the West. We are not like that, and everyone knows this. People in the West have a long tradition of individualism and a much stronger distrust of centralized governments than what you see in China. And that is especially so in the United States. It is an integral part of our national psychology. And yes, such things like that exist. There is a national psychology. And you can see how, in the case of a pandemic, this can be a problem. Because one thing every one of these epidemiologists agree on is that the movement of people is causing this virus to spread rapidly. You can be asymptomatic for a long time, weeks, apparently, and you could be spreading it around. And this is clearly happening, and it has been happening since the beginning, and it has become evident that this virus has infected vastly more people than our official numbers reflect. Now, by what order of magnitude? Well, I don't know. I mean, there are various estimates, but it does seem to be quite a bit. You can be pretty confident that even in your town or your country, your county, if you haven't had it reported there yet, this virus has probably already been in your community for a few weeks or more because it incubates. So we all kept doing our own thing because that's what we do. That's what we do. We do our own thing. But now we realize we've got a problem. So we folks in the West, we don't like having the government step in and force us to act in a certain way because we're not China. We don't want to become China. Western scientists, Western societies still believe in individual responsibility. There is a danger of crises like this one, however, to give the centralized state ever more authority over our lives, even after the crisis is over. Actually, especially after the crisis is over. And all you have to do is think of 9/11. 20 years later, we're still living in the legal system created by the national security establishment from that event. So to me, it seems obvious what we need to do now. If we are societies that are still going to believe in individual responsibility, then we need to start acting like this by voluntarily engaging in social distancing procedures as much as possible. And we need to do it now, not tomorrow, but now. The crisis is going to be made better or it's going to be made worse by the actions of every single one of us. The way not to make this worse is by not being physically out in public, at least big public places, for the next few weeks and maybe longer. We've got to be smart about this. Obviously, people still have jobs. Obviously, we have to get food. We have to get necessities. But we can do these things while being mindful of this situation and not doing things to get ourselves sick or to get other people sick. You know, we talk about seeing these towns now that our cities that we live in looking like ghost towns, looking deserted. I take that as a good sign, frankly, because it tells me that people are actually aware of this and they're doing their part. Yes, it's causing economic mayhem. Yes, there's going to be a lot of fallout from this for a while. But we have to deal with our health first. We will deal with the ramifications of everything once we get that settled. And then we can actually move on to getting our economy going, getting things moving the way we are used to them. Now, here's the thing. Like, if you are not afraid personally of getting sick, and if you're just like, I'm going to go out there, I'm going to do what I want to do, this whole thing's overblown, and I'm going to ask you to think of your parents and think of your grandparents who are much more at risk than you are. Every day that you needlessly put yourself out into a public place, you're actually putting your loved ones at risk. And that's not hyperbole. That's because we have to assume that right now that the virus is spread pretty much everywhere. And if you get that virus, and even if you most likely you're going to remain healthy, fine, that's good for you, but you're still contributing to spreading it around. And at some point, it's going to reach the most vulnerable people. So don't be part of the problem. We need to take responsibility for our actions. In the first place, we all know it's the right thing to do, right? But in the second place, if we don't take responsibility for our actions in this moment, then you can expect a massive, centralized demonstration of power to do what ordinary citizens fail to do. Now, the US federal government is clearly now mobilizing a lot of resources along with private industry to deal with this. But democratic societies require citizen responsibility, especially in times of crisis. And this is a crisis. We all need to do everything we can to keep ourselves healthy and not to put other people at risk. If we fail at doing this simple act of civic responsibility, then we're only demonstrating that we aren't capable of governing ourselves. So I'm not willing to conclude that. I don't think you're willing to conclude that. So we need to do this right. Now, I will close by adding that Tracy and I have voluntarily decided to self-quarantine until we can get ourselves tested. And the fact is, we've both felt under the weather for the last few days. Now, we've been learning this is probably not cause for alarm. The vast majority of people so far who've been tested worldwide for coronavirus have turned up negative for it. We're talking, from what I've just heard, about 95%. And that's for people who've had some sort of symptoms. So that's great, right? In all likelihood, what we have is probably an ordinary type of bug that people get all the time, probably no big deal. But the truth is, we don't know, and we've decided to be cautious. Fortunately, this is what millions of other people are voluntarily deciding to do. We don't want to make things worse. It's a tough time for everyone, and I think we can expect this challenge to last most likely for the next few months. Beyond that, who can really say? But I believe we'll get through this. And I genuinely believe that when we do get through this and we look back, that we'll be proud of each of our contributions to the fact that we did get through this and we didn't make it worse for everyone else. You often hear the phrase, we're all in this together. But this is a time when that means even more than usual. What every one of us does matters right now. So, to all those who support what Tracy and I are doing in our work, we thank you sincerely, and we wish everyone good health. Eat nutritious foods, get enough rest, genuinely try to relax. And just like your mom always said, wash your hands. Thanks for being here with me. I'll catch you next time.